Alrighty, hi guys, Dr. Gideon Kwok here. We are playing with Viola Threads today, and so we have this beautiful gentleman here. And we are going to work on a couple of things. We're going to show you a little bit of our technique with the Double Lyft threads. These are actually threads that actually have two, you can say like sewing, knitting needles on the end that we're actually going to place. We're going to actually work on the under chin area. There's a little bit of extra tissue that hangs down in this area that we're going to try and lift up. We're going to play with the double lift and then see how much lift we get, and then we may come back in with some other barbed or cog to give him a little bit more lift. I also probably will come up a little bit more above the jawline to actually give him a little bit of pull, because I think pulling in both directions like this gives a better look to the area. He's also concerned with some acne scars into this area, and you can kind of see that he's starting to deflate a little bit. So we're going to actually place a couple of mesh threads into this area to volumize his tissue, and then we're going to come back with some twist and some smooth threads to place it superficially. So the smooth threads are going to help stimulate collagen and actually help fill in some of the acne scars, and some really nice improvements that we're seeing with stimulation of collagen into the area. So that's kind of what we're going to do. I'm going to play with maybe a little mesh up into this area to soften up some of the hollowness in this area. I know a lot of people talk about not wanting to do fillers in here, dangerous area. This is another way of actually getting away with using something a little bit more safer, so you don't have those issues. We can actually place a couple of meshes into this area to actually give him a little bit of a brow lifting, and we'll see, maybe we will use a little bit of barbs or cogs to actually give him a little bit more pull on this lateral end that actually opens up the eye and gives a nice lift to the lateral brow. So those are kind of the major focuses onto the area. I may stick a little bit his nasojugal fold starting to fold into this area, maybe soften it out with a little bit of a PLLA to kind of stimulate collagen just along that line to just soften up that in that aspect of it. Alrighty, so let's just do some drawings. So mesh wise, probably maybe two meshes into this area. I probably say I want to put a mesh across here and here, maybe, and then we're going to do a plenty, the PLLA one, just across here lightly, and then we could probably do some twist threads kind of in this direction to kind of really give him a little bit nicer volumization, and actually to help with the acne scarring into this area. Barb wise, let's choose the right vector, so always tug on the tissue and see where you're going to get the best lifting quality for him. To me, I think we're going to start up higher into this area, kind of right in front of the ear, vector point, and we're going to come down and we're going to draw two lines, and we'll do like that. The one underneath, you probably come in about a centimeter below, centimeter and a half below, centimeter and a half below, and then we're going to literally just draw him all the way out in this aspect. Let's start off from there, and we're going to kind of do the same thing on the other side. And that should give us a nice lifting. So this double lift is going to be almost like a necklace. It's going to actually start from the center and actually exit out through this area to kind of hold the whole tissue all up. If you need to later on, you can actually come in with some smooth threads and place them into this area, and that will create a mesh or network to kind of hang and sling the tissue up into this area. You can also get rid of some fat if you go a little bit deeper with your smooth threads into the subcutaneous fat layer. You can actually, with smooth threads, kill off some of the fat as well. It's not a lot, but it can minimize some of the fat. So you'll see people do that with regards to that. So this is kind of the whole thing that we're going to kind of work on him. This lower face is his major concern, but also some of the acne scars.